Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about brand new medical coders and productivity standards. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got a really good email about this. It's from a brand new medical coder who is kind of struggling to hit their productivity standards and everything. And I will get into this in just a minute. I will read this and then we'll discuss. But I will say this before I start. I have always had a ramp up period. And if you don't know what a ramp up period is, when I first start a job in medical coding, is a time where they're giving you at least 90 days to get up to speed, meaning they give you 90 days to learn the system, to get up to speed with your productivity, and of course they want to make sure that you're meeting accuracy. So with that in mind, I mean, I've never had an issue where I've worked, any place, I've worked 4 places, I've never had an issue with them giving me a little bit more time. Now, if you are working in a place where the productivity standards are a little high, and a little high meaning that it's like 200 in a day that they want you to be reviewing. I heard from one person who said that she worked in the ER and they were expecting them to review 320. At that point, 200 and 320, you're not reviewing. You're not even coding at that point. You're just pushing things through. And for all intents and purposes, I want people to know this. Medical coders, it does not matter where you got your training, who told you. What matters is what you select. You have to be able to support the things that you have selected. You cannot say to somebody who's auditing you, well, my supervisor said that I need to do it this way. At the end of the day, their name is not on that record, yours is. So if somebody is auditing you, and especially my brand new coders need to hear this, and even veteran coders too, if you're listening. If you are being audited and told that you are incorrect and that you need to code this other way, then you have every right to ask for the coding clinic, for anything that supports the way that they're asking you to do this from a reputable resource. And not that, oh, this is the way we do it here, well then I need to see a regulation. Okay, because I'm not just going to put my name on anything, and I'm not just going to select anything just because I'm being commanded to. That's not the way that it works. Coders, and especially new ones, need to learn that you need to think for yourself, and you need to be able to stand up for yourself whenever you're in these situations. Now, I'm not telling you guys to be confrontational. Never. You want to be as professional as possible. But you do need to be able to find this out in the beginning, what your productivity standards are going to be. How long do they expect to give you to get up to speed with everything, with learning the system? Because learning a new electronic health record, and these electronic health records, trust me, I've worked with quite a few of them, and they can be quite finicky. And there's only one I truly did like. But the rest of them, they can go away. But that being said, not all of these electronic medical records are easy to work with, number one. Number two, it really all depends on what you are looking at and how critical, intensive are these encounters that you're looking at, or these charts. It really all depends on what setting are you in, obviously. So take a look around. I always say a good rule of thumb for the outpatient setting, if you are coding for like the ER, for like outpatient clinics and things like that, anywhere between 80 to 150 a day average is acceptable. It is doable. 150 is a little on the high side, but when you get into some of these really sort of mundane clinics that go the same thing over and over again, it does become a little bit easier to hit. For me, being in a specialty clinic, my productivity is 90 per day. So that is acceptable because to me, okay, it takes a little bit more time when you're working with the specialty clinics like I am. So if you're anywhere between there, 80 and 150, it is doable. Now, if you get over 100, obviously you are literally not moving from your desk, and you're having to Make sure that you are really engaged so that you can meet productivity standards. Now, when you start getting higher than that, higher than 150, you run the risk of just pushing things through and sort of relying on whatever the electronic medical record has selected or whatever the provider has selected. And this is very wrong, because a lot of times the electronic medical record is wrong, and a lot of times the provider is wrong, because the provider is not meant to be the medical coder. You are the medical coder. That is why you have a job. It is your job to know all of the rules. And if you say, well, they so-and-so didn't train me or they didn't tell me, it's not on them. That's on you, because that's what we do. As medical coders, it is our business to learn everything that we need to know. Okay, so we need to do this by asking questions, being proactive, and continuing to study whatever it is that we are studying, whatever specialty, and knowing about the particular procedures that go on, and even the diagnoses that are more prevalent in that particular specialty is really important. So you want to make sure that you're doing that. I've seen so many horror stories from people who say, well, my supervisor told me that I had to code it this way, and I can show them where it's wrong. And, and it's like, you need to make sure that when you are proving your point too, that you have a reputable resource, whether it is from CPT Assistant or Coding Clinic, or even from the official coding guidelines or from CMS. You need to have some official resource, okay? And if you and your auditor can't work it out, then you need to go up the chain. There's always going to be a chain of command, if you will, of people that, okay, there's somebody above this person, there's somebody above this person, but you want to try to make sure that you're handling it at the lowest possible level. And you want to be as professional as you can with your auditor, with your supervisor, or whoever is auditing you, and make sure that you really understand what they're trying to tell you, so that you're coding correctly and accurately. Because the auditors are not always correct, okay? And sometimes they get very upset when they get called out for being wrong, but they're human as well, and no one likes to be wrong, right? But at the same time, when it comes down to brass knuckles, this is medical coding, and it is not about the auditor, it is not about you, it is about the patient, it is about the provider. Those are the two that are most important, because if the patient is being overcharged or undercharged, it immediately affects the provider, okay? So, and I want you guys to pay attention to these articles out there about these cases where, medical coders do get called in to testify at these trials that go on, when these people get called in, when their billing practices are getting questioned. So this is why it is very important that you all learn to properly and appropriately code, and that you stand up for what is appropriate when it comes to coding out these records. It's not enough to say, well, I didn't know. Ignorance is not an excuse, okay? So I'm going to read this email, and then we're going to talk about it some more. All right, so the viewer says, good evening. I started an HCC position, hierarchical condition category coding, last month, and previously held 2 ROI positions. That's release of information. Now, release of information has nothing to do with medical coding. It is just making sure that you verify who you are releasing the medical record to, and if this person is pertinent to have this medical record. An HCC or risk adjustment coding, that is just diagnosis coding. There is no procedures, there's no E&M involved in HCC coding, okay? They go on to say, I am now HCC coding and I enjoy my job, even though I love procedure coding. Again, it has nothing to do with HCC. It has been less than 2 weeks and I am up to 50 records a day, but they said I need to be at 80 to 100. How can I increase my productivity? Out of 60 people, only 2 people are doing 50 to 60 charts a day. I don't understand how they get that number when each encounter of mine is between 40 and 60 pages. I have a meeting with my boss this week, but I don't know how to explain why I cannot reach 80 to 100 charts. Thank you for your help. So here's the thing. Sometimes these places are setting these standards a little too high, and sometimes it's that the coder needs a little bit more training from whoever is their trainer. Now, if everyone else is reaching this 80 to 100 and in such a short amount of time, I would question too, because that just seems like you're kind of like just speeding and entering things through and not really paying attention to what you're doing. I don't know. I mean, I'm not there, so I don't really have a way to say yay or nay. But from what the viewer says, you know, if every encounter or every chart is between 40 and 60 pages, that's quite a few pages to have to go through per each time that you're looking at a chart. So with that, I would explain to the supervisor or to the manager that, you know, maybe there's a little bit more training that needs to be done, because if you are looking at how accurate are you? And that's another thing too that you could say. I've been compared before too. I was doing training for one of the new coders that had come in a few years ago. And one of the supervisors was very loud and, you know, just kind of one of those bossy ones that when you look at the way that they manage, they could use a little bit more training themselves. But anyway, this supervisor, the girl that I was training was one of those ones that I know it. Oh, I got it. She was one of those. And this was her first job as a medical coder. She was not yet certified. She had come over from being a biller. And so it was my position to train her because I was a senior most coder in that clinic. And so, okay, well, let me help you. And she didn't want my help. She just wanted to race through. And so I said, okay, well, nothing I can do, you know, it's all right, you know. And so the supervisor came by later and she said, well, I want to know why she's able to do more than you. And I said, okay, well, first of all, I said, I've been training her. And second of all, you need to check the accuracy of what she's been submitting before you compare us to. And so she did, and the boss above her ended up finding out. She says, oh, no ma'am, you should not have asked Bleu why she wasn't doing as much. Bleu is doing exactly what she is supposed to. Those that were submitted through the other part of the thing were wrong. So that other coder needs to get back over there and correct those and make sure that she puts them through correctly before they get submitted. So that's the thing. You can't always look at what other people are doing around you. And if they are doing high above you, it doesn't necessarily mean that what they're doing is as intensive either. So I don't know if the other coders are doing something that is easier, and maybe that's how they are able to get through so quickly. And that's something that you can ask. You know, but I would really advocate for this viewer to go to their supervisor and ask them to just review for accuracy to make sure that, hey, are they accurate? If they're accurate, all right, it's going to go up. There's a way to negotiate that, you know, you will get better. But, you know, I mean, again, I don't know any more than what is being told to me here. But I will also say this, if you are struggling, sometimes people do struggle with their productivity. I'm not saying that this is this person's problem, but sometimes people struggle with productivity because they're on their cell phone. I've seen medical coders that I've worked with do this, where they say, I can't meet productivity, and then you see them on their phone. That's why you can't meet productivity, because you're on your phone. Or they're talking, you know, so it really all depends too. There's also those other factors as well. Some people act like they're just so addicted to their phone. You know, there was a time and a place where we didn't have cell phones, and, you know, people were able to do their job and work and things like that. You know, you need to be able to put your phone away, you know. And if you tell me, oh no, Bleu, I have a family emergency, and you don't have a family emergency 24 hours a day, okay? You have time that you can be working. Obviously, if anything was to really happen, then obviously somebody would get a hold of you, clearly, but, you know, you don't have to constantly be on your phone, because a lot of times that's not even what it is for. It's just a lot of times people will be on there for Instagram or Facebook or TikTok or whatever. And so that's something that you have to really keep in mind. This field is about reading. We read all day long. So the more you're in this field, the longer you're in this field, you will become faster with reading. But it does take time to get used to that. And that's what I would tell the manager as well, that you're still brand new, that you're still learning, that you want to make sure that everything is accurate, but you do realize that this is a productivity and a time type thing. So maybe somebody can come and coach you to see if there's something that you're doing in the process of coding, the way that you do, that can be made more efficient. Okay, maybe there's something that, you know, they're doing an extra step or something that doesn't need to be, and that could always be. So that's what I would suggest. But don't let these people bully you into to going faster when some of these records are going to take time. Now, obviously, you don't want to sit there and take your time on every single one, and you want to get into the habit of you know, getting things through quickly and efficiently, but accurately, because accuracy among everything else is most important. When I worked for a level 1 trauma hospital, and I was doing this remotely, you know, level 1 trauma hospitals involve you know, major things like, you know, they go to the ER and they've had a car accident, and of course they've had multiple injuries. And when you have things like that, you know, those things take time to code. I mean, you can't rush through those, you know, and you always want to put through clean claims anyway the first time. And so I was getting quite a few of those that I was running into, and my productivity was kind of low. And my boss, Trish, she was like, hey, wonderful lady, great lady. She says, hey, Blue, I noticed you took a dip on your productivity. What's going on? And I said, okay. I said, well, I had this one, and I said, I was telling her about it. I said, it had all of these. And so she pulled my records to see what was going on, and she's like, you've had like trauma after like accidents and all this other stuff. I was like, yeah. I see, these were not easy. And so she figured it out that people were skipping charts. And so that happens too, but in coding. I don't know about HCC, I'm sure they do that too, but in coding, they were just skipping them. And I was getting all of them because I was working in the evening. So whatever the day shift didn't want, I got. And so there was a big meeting about it. But I was given a little bit of grace by my supervisor, and she was like, okay, well, we're going to give you back some of this time, and we're not going to count this against you, because clearly these are very intense charts, and you needed the time. And one of them had 32 different diagnoses and procedures and all that good stuff on it. So it was quite a bit, and it's not anything that was easy. These were all complicated, and she saw that. So I did get some grace from that. But it does take you to speak up and say, hey, some of these are 40 and 60 pages, you know, and if I'm getting that consistently, that takes time. And to be at 50 and have to go through that many pages, I think that's good, but then again, I don't know, you know, on it there. So, but that's, you know, that's just what I would suggest, because that's quite a few pages to have to go through, you know, in a day. But you know, that's what I can say there. Medical coding is not just about knowing how to code. It is about how to defend yourself. It is about how to advocate for yourself. It is about learning how to find the answer that can support what you've selected. This is why I always tell you guys to continue to study, because as you continue to study, these things will get easier for you. And the better, the sharper that you are with medical terminology and anatomy and pathophysiology, particularly when you work in HCC, you want to be really good at pathophysiology, because you need to understand the disease process, especially when you're working with this kind of coding. But it will get easier over time. You will get faster as you get used to the system. But I think under 2 weeks and you're already being demanded, like, why aren't you already up to speed with between 80 and 100? I think that's a little bit too much. And then the other thing that I want to say before I close this up is with HCC, it's a great place to start for brand new medical coders. However, you do not want to get stuck coding HCC, because as you get experience, right, employers will not consider, a lot of them will not. I know, because I look in the job listings, a lot of employers will not consider HCC coding as coding experience, because it does not involve evaluation and management coding and procedure coding. So while you may think, oh yeah, I have 2 years of experience, they are going to know, if you've only been working in HCC or risk adjustment for 2 years, that you've only been doing diagnosis coding. They're going to know that that's not a full encompassing, procedures and E&M. So you're going to need to spend as little time as you possibly can there. Try to find a job that is going to get you exposure to procedures and evaluation and management as well, because that's where you're going to really gain experience and you're going to really get the full feel of being a medical coder. Now, this viewer said that they love procedure coding. You don't want to lose your knowledge either, okay? The longer you are away from it, the more you're going to get rusty, and especially if you are not studying. So that would be what I would suggest. I would continue to put my resume out and find another place to work that is going to be more fitting for me. If you are in a place that the productivity standards are too high, or they're making such demands right away, I would continue to work until I could find something else. I would continue to send out my resume so that I could find something else that would be more suitable for me. I'm not saying to leave this job and have no job. I'm telling you that I would continue to work until I was able to find something that was more suitable to me, which would be something that would give me that exposure to diagnosis, procedures, and evaluation and management coding. At least that's just my advice anyway. So that's where I'm going to leave y'all. And best of luck to this viewer. Best of luck to you if you are a brand new medical coder. And if you are going through this right now, what is your productivity standards as a brand new medical coder? Leave it in the comments below. So I'm going to wrap this one up. Thank you all for joining me. If you haven't had a chance to, I hope you will like and subscribe, and I will see y'all next time. Bye.